Hi, everybody. It's a real delight to see you all, albeit virtually today. I'm Patricia Finn, and I'm still the new Dean of Medicine for the School of Medicine, and really proud to be here. This is a pretty exciting time. I do remember when I first spoke to Dr. Ziedonis, our EVP, who I'll introduce in a minute, and he said that there was so much to be joyful and thankful, and also actually to do in New Mexico as a way to woo me here, which he did completely. I am here and I am loving it. But that really, it would be based on a strategic plan for which he had careful thoughts and strategies about, and which he's going to share today. And I want to ensure you, as I know Dr. Ziedonis will repeatedly say, there's still plenty of ways to be involved. This is your strategic plan. This is our strategic plan. And so I would ask you to be engaged. I know it's a long session, but there's a lot to do, and there's other ways. You can just use your QR code and pump in if you like. There's many ways to do it. So without much ado, I'll turn it over to Dr. Doug Ziedonis, our EVP.
Thank you, Dean Finn. It's great to have this opportunity to be with all of you, faculty, staff, and students in the School of Medicine. The last 2 weeks has been a busy and good time for me. I've met with all the colleges in a town hall similar to this, our foundation leaders. We have the board of trustees of the UNM hospital tomorrow, so that we're out in the community and we're all over. So as Patricia said, we are engaging as many. Everybody's voice counts and has an opportunity to be involved. You should have received 4 handouts. One is focused on the survey, one's focused on the idea scale, which is a crowdsourcing strategy used for UNM 2040 here. Also a brief 2-page summary on the 6 strategies and the mission, vision, values. These are drafts, and I'm going to explain the process and where we are, and then keep my presentation short, but you'll have all the materials. So we know that in a meeting like today, even with 184 people, that we will not be able to hear everybody's voice on this screen, but everybody will have an opportunity to put comments in the survey that I'll talk about. So I'm going to switch to presentation mode. And go. All right. So let me first start with gratitude. Gratitude for everybody on this call, as well as everybody else who's still off doing something different. Whether you're on the Zoom call for most of your workday or in the lab, in the healthcare setting, seeing patients at the front line, thank you. Thank you for your support. We have been working on the strategic planning process. We're about halfway through, a little bit more, but still lots of opportunity to influence the process. And that's why we want to make sure to get you where we're at, but let you know that there's still movement. We wanted to achieve alignment with UNM 2040. If you haven't seen that before, just go UNM 2040 in your Google search and you will find the web page that has that all spelled out. Of course, also, we're an airplane in motion, so there have been lots of strategic plans by units, by the health system, by health sciences, so that all those were brought together when we started this process to be thought of. Another important ingredient was across health and health science, within School of Medicine and the colleges. How do we integrate? Where are the opportunities? Where are the necessities that we need to do? The third is create an engaging process that you all could participate in. And the School of Medicine is very well represented in our planning group, our design thinking groups, in our work groups. So at the end of the day, this is kind of the bottom line. If you could take a picture of this, but you have it in your PDFs, on the right in the gray is the survey link, and it'll become much clearer of what to put in the survey in the sense of what are you responding to, what would you be adding. And the idea scale, the survey is anonymous, and the idea scale, if you have a UNM email of any nature, you'll be able to get into the idea scale and add comments. We ask you to also disseminate, cascade this to people on your team. So if you're a chair of a department, if you're a division leader, if you're a program leader, a team leader, make sure that you talk about this and ask people to provide input. Here's where we are on the timeline. This is a 24-month engagement, and we're at week 15. We did a lot of listening, a lot of reviewing of old materials, plans, budgets, facilities, and now we're in the phase of establishing what our key goals are, but going deeper into how we're going to prioritize next steps. So we had about 1,000 people provide input on the mission, vision, values, strategic focus areas, lots of different formats. About 550 people responded to the survey, and the others in other formats. Then we had a group in December work on the 6 strategic areas to start identifying key priority areas that we'll focus on. And right now we're in the work group focus of reviewing those priorities, establishing goals for them, and moving to action steps, performance measures, budgets, timeline. This is our draft of the vision, mission, and value statements. It builds on what we've had before. It considers what UNM Hospital has, what SRMC has, what School of Medicine has, what the Department of Internal Medicine has. All the groups that might have something, people reflected on it. Transforming health and health equity for New Mexico and beyond may be also very clear to us. Is it clear to our patients who might read this? So your feedback on this, there's a unique opportunity in both the survey and the idea scale. These are the 6 focus areas. We've talked about some of this before, so this will just go to a deeper dive on it. Prioritize workforce development, recruitment, and retention. Big topic, elevating behavioral health, including substance use and mental health, enhancing health equity, particularly rural, Hispanic, Native American, but also other underserved groups. At the bottom of that paragraph, Black, Asian, LGBTQ, veterans, those with disabilities, etc. Right side of this slide, expand impact through research and economic development, enhance access, quality, and safety, enrich the student experience, and educational innovation. Now, if you look at the gray bar at the bottom, the UNM 2040 goals, advance New Mexico. Well, that had a lot to do with our clinical system, research, and economic development. The student experience and educational innovation are literally the same topic area, but now more specific to health and health sciences. Inclusive excellence, we see that as a core value that goes across all of our work. Sustainability, of course, also our people, our resources, fiscal, space, all those are important for all our topics. And one university, we've also tied through all the topics, including having members from the central campus and elsewhere be part of our process. This is one of your PDF handouts that goes now further with each of one of those 6 topics. These are the emerging draft priorities on the 2 columns on the right. So you could look, for example, at prioritizing workforce development, priorities of implementing evolving compensation and benefits models, expanding and strengthening partnerships and pathways, create a safer community, improve culture, increase faculty and staff recruitment and retention, improve how we tell our story, what are the facilities needed, and one university opportunities and necessities. So within each of those 7 things, it gets more detailed in what the work groups are doing. This was the first effort with the design labs, and they expanded each one of those areas into much more detail. And again, you have that in your handout, so I'm not going to go over it in detail. The rank issues is what the group on the right, and we invited people from school of medicine, all the colleges, other leaders, and not everybody could make this design thinking, but we've had great participation with larger work groups. The rank means that of that group on the right, 6 of them said their first priority was number 1 on the left, and 5 gave it a secondary vote, and that's what red and green mean. We've asked the work groups to think about what would enable that strategy area to do be successful and do better. Is it funding? Sometimes we need a poor man's budget, as well as if you had more resources. What about community support, technology, leadership and org change, state level support, communications and marketing, safety and facilities? So right now, the working groups, this is where they're at. They're building out action steps for each of the priorities. They're thinking about how to integrate and overlap with the other 5 areas. They're looking at one university opportunities and necessities. So for example, this is just me talking. If I were thinking about research, I might think we have amazing pockets of addiction research across the whole university. An opportunity is to bring them together. We have amazing work going on in climate change and public health, another opportunity to bring things together. I might say data science, biostatistics, bioinformatics would be a necessity that we could partner with the university, but would really require engineering and business and other groups to work, mathematics to work with us on that. What's going to help this area? How do you measure outcomes? What's the budget needs, including space, and what might be a realistic timeline? For each of the priority areas, the work groups are filling out what's the scope, what are some goals, action steps, metrics, overall timeline. What enablers will help this priority to succeed, and how does it link to others? This is a very early draft, but this is an example. When I met with the foundation, I said, look, we haven't figured it out yet. We're not in a draft of final yet, but give us some feedback if we were trying to also get foundation funding. And these were some of the topics, and we had a really great, lively discussion about these as an example. So again, your voice is important. The survey links to those 6 items. It's pretty straightforward if you know what we just went through and you have the handouts. Then the idea scale is more open and important. So if you say, hey, we ought to do a dissemination implementation science center, or we ought to have a particular service of some nature, put it in those. So the survey, again, is easy. The idea scale, a shout out to Cinnamon Blair and her team on for the university and marketing and communication. They really helped us make this look great. And also Melissa Romine and Carly and Chris on her team, who have done a great job. So again, access through the QR code is easy. Anybody with a UNM email can do something. And this is what you'd get. On the far left, when you go to the first page, you'll get the Let's Innovate Together. Up in this left-hand corner above the picture is a drop-down menu you could push, or you could go to the pictures below. We have 8 boxes, the 6 strategy areas, mission, vision, values, and then other. So you could come up with something totally unique that has nothing to do or something to do with any of the others. There'll be some type of form that looks like the one on the right where you then just type in your ideas. I'm not going to go through all these, but just let you know that you have in your handout all those others. So I'm going to stop at this point And Dean Finn, hand it back to you. We're now up to 200 people. But for people who might have come on later, A, we have it on video, and B, all the handouts, which might have to be resent, Ivy. I don't know where we were on numbers. It might have to get reposted in the chat or sent out later.
They're in the chat, Dr. Z.
Okay, well, I just want to make sure for people, sometimes if you join a call late, you don't get it.
I can do them again.
Okay, thanks.
Thanks a lot, Dr. Ziedonis. I really just want to repeat and reaffirm what Dr. Ziedonis said. This is your time. You'll have many other times, but whether responding right now, a question in the chat, making sure you use your QR code to send survey and responses, or looking at the data and the links, really want to hear, because this is our strategic plan. So I'll just emphasize that and leave it at that. And I'm wondering if we do have some comments in the chat, and we're ready for that.
Sometimes in smaller groups.
Oh, I'm sorry about that, guys. So yes, please, everybody, if you have any questions, comments, thoughts, please enter them into the Q&A box at the bottom of your screen, and we will go through those. Dr. Z, while we're waiting, I actually just have an observation that I really, and I was really happy to see on the graphic with kind of the cycle of priorities that you showed, the circle graphic. I loved how, although it's a circle and has no beginning or end, aesthetically, it really felt like it begins with our students and it culminates with our students. And as someone who has an incredibly deep love for higher education, that really was something that moved me, and I'm happy to see that focus on our students at both sides of their particular education cycle.
Right, thanks. Well, the students are, vital and important, and things like the Leo office, that's a best practice for the School of Medicine. Is that something that could be expanded to all the students? These are things that I think in the strategic planning office of supporting students. What else could we do? There are a lot of ideas in there, but the 200 people on this call are also able to help. I see a couple of questions in the chat, so I can just start addressing those. So Melissa Romine, shout out to her because she's really helping us with so much in the marketing and communication. When should this be wrapped up? Well, right now our plan is that by the end of March, we will have finished the planning process. We would have clarified the strategies and priorities. We would be linking it to fiscal budget planning. We'd be linking it to facilities. And then the next phase moves into implementing. And so there'll be, again, many opportunities for people to be part of implementation teams. And I also imagine that there will be units that do strategic planning themselves to say, hey, kind of like what we did with the university, that we waited till they finished and then we moved into doing one that would be aligned, but also address the unique needs within each of our groups. So I anticipate maybe in May that there would be some kind of glossy, nice PDF or handout that Melissa's team would put together to make sure we have good communication on it. And then also clarity as we move through the implementation phases. All right, so then thank you, Mark, for your very helpful comment. We only have it in English. We have a plan with Melissa. I don't know if there's a way to bring her into the panel to answer this better than I would, but I'll take a crack. We had a lot of conversation about what we might do about the bilingual aspect of it. We, in a similar way that Melissa has done marketing and communication, there are going to be cascading activities of engaging with frontline folks, community, and that's where there'll be both bilingual presenters to present the material and to walk through the process. Melissa, you might be able to help us if in your, I see you're joined the panel, how we might be able to do beyond that.
Thank you, Dr. Z. Some of the strategies we'll be working with several of the leaders across UNM Health and Health Sciences to make sure that we're reaching our frontline staff, that some folks just don't have access to computers. They're not sitting behind their screens all day. They're out there doing the work. So we'll be reaching out, and it'll most likely be me reaching out to most of the leaders here and trying to coordinate that. In the past, the way that we've done that is actually set up meetings where we bring laptops and walk folks through the surveys and also give other ways of giving feedback and work with translation services to make sure that, you know, we're able to communicate effectively and efficiently for those who, you know, English may not be their first language. So a lot to come and a lot of work to do, but we definitely want to make sure that everyone is heard and that this is explained in a way that everyone can understand. Thank you.
Yeah, great. And I want to thank Lisa Kakari Stone. We've had really great engagement with the community through our health equity dialogues, and about 300 people who provided some great input that was part of the process. And those were across the whole state. Ashley, thank you for your leadership and also your comment. So in addition to the surveys, individuals like yourself, mid-level leaders, you've called yourself a leader yourself, you will have opportunities in a couple of different ways. One, if you had specific feedback like your paragraph that you put in the Q&A, you could go online into the survey, literally just cut and paste that section, put your name on it, because remember the surveys are anonymous unless you put your name on it. We are collecting all the survey material. Our team is reviewing what is put in, and then if people identify themselves, then we can do follow-ups. Another strategy is that we have work group leaders in each of the units, so you could also express your comments to the individual work group leader. And the one you're talking about is the student one. And Gina, I don't have the list in front of me for each of the work group areas, but if we had that, we could also put it in the chat.
Sure, we'll do that now.
Great. So thanks, Ashley. And I would say the survey is anonymous if you want it to be, but it could be also the message board. Also, as we engage with community, patient family advisory councils and others, they might not have a UNM email, so they can't get into IdeaScale. So we've encouraged them to put their name on if they want into the survey. We told them only the planning group would see those. And there you can see the work group. So Ton Hinson from Student Academic Affairs could be your contact person, Ashley. But if a project develops over time, and I think the topic you're addressing is an important one, so I'm sure it will be part of the plan.
Does anyone else have questions, comments, thoughts?
Well, hopefully it was pretty straightforward. I think this group just gets you to ask a question for clarity or anything else you'd like to share with the School of Medicine. I think when we don't see your faces, I can't call on you as well, although I can see your names in the attendee list. But School of Medicine is a large group, so if I see a surge over the next 12 hours of people from the School of Medicine hopping on, we will have accomplished our goal of making sure everyone knew they had an opportunity and that you followed through on that.
Doug, can I add? That's great. Just as you look in the chat, these work groups, I know I'm on one of them. So those are folks really trying to put it together. You mentioned Todd maybe for student, but each of those people, poor God bless Mark Unruh and research. So just, you could also reach out to them if you want to see or hear, in addition to every modality that Dr. Ziedonis suggested.
Yeah. Well, I see as I scan through the attendees, got a lot of chairs on and wide range of faculty and staff. So thank you all for being there. Okay, it looks like another question.
I took care of that housekeeping, Dr. Z. We'll drop the chats again for everyone.
Great.
Oh, Ivy just did it. She's lightning fast. Thank you, Ivy.
Is there a close date for the surveys? No, but the next 2 weeks are critical to getting early influence in what will become a more concrete strategy and tactics. We will then come back to everybody with the updated version that has lots of input into it. It will be the version that we're moving forward on around the finances and space. So my recommendation is put things in the next 2 weeks, but know that we're not closing the survey through the whole process. So if you get a brilliant idea in the middle of March, well, please still put it in. But we'll have other reminders on it. We just saw that this is a critical 2-3 week time period, and that's why we wanted to reach out to you today and make sure you had the information. And if there are any questions about what you saw or just you wanted to express something. So thank you, Barbara, for doing that.
Okay, everybody, we do have a hard stop. We're about 3 minutes past that, I believe. So we do have one more thing real quick. This may be a technical question that we might have to get back to you, Dr. Lambert, but Dr. Ziedonis, Dr. Lambert saying that the survey data does not seem to be filtering into their working groups. How will that happen?
Thanks, Christoph. We spoke to Deloitte this week, and that information will get to you. So that's the answer. So that's why we have this 2-3 week period to get the comments to you. But good to ask that question. But when Bob Karen is in your group, please just reach out to him in that way. But we have talked to him about that, and so I anticipate that in your third official meeting, because I know your group in research has had many in-between meetings, and I congratulate you and others for doing that. It should be in your third week group, and I know we'll probably have 5 by the time this is over for the work group. So Gina, you're hearing Chris's comment too, and Christophson will remind Deloitte about them. Thank you.
Well, thank you, everybody. I'd like to give just 1 minute to Dr. Finn to kind of close this up, and also give a reminder that we will be having another town hall on the Press Ganey survey on Wednesday of next week, February 1st at noon. Thank you.
So I want to thank Dr. Ziedonis, everybody on the line, actually each and every person for all your input. Pretty exciting time. I know we've had quite a ride and we're continuing 3 years into a pandemic, but I really hope and count on all of your input. And I know that's the only way that we can all move forward. I'm really delighted to be here and I'm loving all the data. It's good. Thank you.
So, Dean Finn, I just wanted to answer Chair Carnegie's comment. If she's having difficulty logging in, it should be really easy on the survey. If the idea scale link is problematic, I haven't had that personally, but I think what we might do is then send an email out after this so that people could get technical help if they were having problems. And Melissa, Romine, we might think together about how to do that through your office or Cinnamon's office for the idea scale. I think the survey's really straightforward and easy, and if the link isn't working, we'll figure it out. But thank you on that one. Oh, there's a good email in there. strategy@salud.unm.edu for any of the idea scale issues. Thank you. And Gina, let's put that on our next slide deck, that we make sure to, if they have problems, where to go, because the survey is really straightforward.
Yes, sir. Will. Thanks, everyone.
Thank you.
Thank you. Bye.